Hello everyone! We did our study on the efficacy of 2 mindfulness exercises on decreasing stress in dementia caregivers. First, we will look at burnout rates. The highest burnout rates can be found in emotionally challenging professions such as medicine, social work, law, etc. The Maslach Burnout Inventory, the MBI, measures burnout rates. The 3 parts that they measure are emotional exhaustion, depersonalization, and inefficacy. Burnout is comprised of 3 distinct components. These 3 components are emotional exhaustion, which for example is extreme mental or physical fatigue, cynicism, which is a detached response to workplace services, or reduced professional efficacy, which is a perception of an inability to successfully complete tasks. However, the most common cause is stress. When it comes down to preventing burnout, Ginley 2016 suggested that we should start looking into strategies that address personal skills that will prevent burnout. An example of one of these skills would be mindfulness. Mindfulness is a purposeful, non-anxious, reflective presence that can be applied to any aspect of medical practice. The basis of mindfulness is bringing attention to one's internal and external experiences that are occurring in the present moment. Some fields that have started to use mindfulness are education, medical professions, personal, or the United States Marines. There are 3 types of mindfulness methods: mindfulness-based stress reduction, dialectical behavior therapy, acceptance and commitment therapy. Our study focused on ACT. The use of these methods have helped researchers move into the comparison of comparing medication and mindfulness. In one study of medication versus mindfulness, they looked at ADHD. As we all know, medication is the treatment of choice. They found that mindfulness has the potential to be effective in reducing the need for medication for children with ADHD. In another study, they compared mindfulness with antidepressant medication. They compared these two for the prevention of depressive relapse. Mindfulness increased the capacity for wider experiences and decentering. As a result, they found that depression scores decreased when associated with increased wider experiences. Safety is always a concern when working with individuals with disabilities, and especially when you're in a profession in which you are a caregiver. Mindfulness has been shown to improve the culture of safety for staff and patients. Hellman et al. 2014 implemented a brief mindfulness training program on a high acuity psychiatric inpatient unit. Staff ended up reporting as a result of the mindfulness training program that they had lower stress levels. And as a result of these lower stress levels, the results showed a trend toward positive impact on patient and staff safety. Sin et al. 2008 did a mindfulness procedure with staff in order to reduce the use of physical restraints. They found that it was beneficial to staff and participants, and it also reduced the use of physical restraints in their facility. Baker et al. 2015 showed increasing numbers of people living with dementia in care homes, thus equaling increasing amounts of stress for staff. Oken et al. 2010 question: can mindfulness decrease the rates of stress in caregivers of individuals with dementia? In our study, we used the PSS and the MAAS. The Perceived Stress Scale is designed to measure the degree to which situations in one's life are appraised as stressful. The Mindfulness Attention Awareness Scale measures levels of mindfulness. This scale demonstrates promising psychometric properties and theoretically consistent relationships to brain activity, mindfulness-based intervention outcomes, and mediation of MBI effects. The purpose of the current study was to determine whether 2 mindfulness exercises would be effective in decreasing perceived stress levels in dementia caregivers. The 2 exercises were loaded down and do not hit the crack.
Participants were 3 neurotypical dementia caregivers. Cam was a 45-year-old female caring for her mother. She initially scored a 29 on the perceived stress scale, which indicated high perceived stress, a 2.5 on the mindfulness scale, which indicated low mindfulness scores. Marlene was a 30-year-old female caring for her grandmother. She initially scored a 27 on the perceived stress scale and a 3 on the mindfulness scale. Dai was a 40-year-old female caring for her mother. She initially scored a 31 on the PSS and a 2 on the mindfulness scale. These both indicated high perceived stress and low levels of mindfulness. All sessions took place in a private room at a community center in High Ridge, Missouri. Baseline was 4 weeks long, 4 sessions. The mindfulness programs were both 11 weeks long, 22 sessions each. The materials used were the Perceived Stress Scale, mindfulness awareness scale, tables, chairs, and mindfulness handouts. An alternating treatments design was used to compare the effectiveness of two mindfulness exercises on decreasing perceived stress levels in dementia caregivers. A was baseline, B was loaded down, and C was do not hit the crack alternated. These two phases were alternated in the same phase. C was the final phase. It was the most effective intervention of do not crack. Baseline consisted of identifying the participants' perceived stress score and mindfulness score prior to the mindfulness program's beginning. There were two phases to this design. The first phase was the two mindfulness programs rapidly alternated on the same day. The second phase was ending with the more effective program. The procedure for loaded down was twofold. It was 1 hour long in the early morning, twice a week for 11 weeks. The first section of the exercise was a group discussion. Experimenter presented 5 modified objections for the participants to discuss. The second session, however, consisted of a scavenger hunt. Experimenter asked participants to each place 5 possessions that can be put on their body in the center of the room. Therefore, extra materials were not needed. Participants then took a 5-minute break to allow experimenter to hide materials around the room. After the room was prepared, the participants went on the scavenger hunt and collected verbal cues. Participants were instructed to stay in the present moment, and if their mind wandered, they had to pick up an item and put it on their body. After the scavenger hunt, participants counted how many items they were wearing. A discussion followed. Did focusing on the present moment come easily or was it difficult? Did you feel loaded down? Mindfulness homework was given to participants to complete throughout the week. This procedure was completed twice a week for 11 weeks. The procedure for do not hit the crack was also twofold. It was conducted on the same day as loaded down, but it was 1 hour long in the evening. The first section of the exercise was a group discussion. Experimenter presented 5 modified objectives for the participants to discuss. The second section consisted of going outside to the sidewalk. The experimenter explained that they could not touch certain cracks. They were then instructed to go on a 10-minute mindful walk on the sidewalk while following the rules of the cracks. After a few minutes, the experimenter would change the rules pertaining to which cracks to avoid. A discussion followed. Experimenter explained how difficult it is when we make rules for ourselves or tell ourselves not to think/do something. Was it more difficult to avoid the cracks the more you thought about it? Was it difficult to remain in the moment? Mindfulness homework was also given to the participants to complete throughout the week. This procedure was completed twice a week for 11 weeks. The final phase ended with the more effective intervention. After both exercises had been presented the total 22 sessions, the final phase consisted of the more effective exercise. Do not hit the crack was administered in the final phase for 2 weeks or 4 sessions. The results were as follows. For Cam, her highest perceived stress score during loaded down was 26. Her highest score during do not hit the crack was 9. Marlene, her highest perceived stress score during loaded down was 26. Her highest score during do not hit the crack was 9. Dai, her highest perceived stress score during loaded down was 30. Her highest score during do not hit the crack was 13. As you can see, the results concluded that do not hit the crack was the more effective mindfulness exercise because their perceived stress scores were much lower. On the MAAS, Cam's final score was a 5, which indicated high levels of mindfulness. Marlene's final score was a 6. And lastly, Dai's final score was a 5.2, which indicated high levels of mindfulness. This is the graph for the participants' scoring on the mindfulness awareness scale. As you can see, their first score was much lower than their second score. As you can see for both Cam, Dai, and Marlene in the next slide, do not hit the crack was the more effective intervention as it is higher than loaded down.
What our study showed is that the do not hit the crack mindfulness exercise was more effective at reducing levels of stress amongst caregivers than loaded more exercise. Levels of mindfulness were higher with do not hit the crack than with the loaded more exercise amongst all 3 caregivers. Our results coincided with previous studies such as Hallman 2014 and Singh 2008, which in both studies mindfulness exercises were effective at reducing stress with staff at a residential facility that housed patients with dementia. Limitations of our study. Our study controlled for threats to validity such as maturation, treatment carryover effects, and data evaluation. A few limitations were present. History Mindfulness exercises were conducted over 11 weeks, and events in the home may have contributed to the effectiveness of mindfulness exercises. Only female participants were recruited, and we did not apply the intervention to caregivers in a residential facility. Repeated testing. The MAAS was given twice, pre and post test. For future research, future studies should include male and female caregivers, be implemented across different settings, like in the home and residential facilities, and should apply mindfulness exercises to both caregivers and patients with dementia. And self-monitoring strategies should also be implemented to determine if participants are continually engaging with the mindfulness exercises.